In terms of tramadol usage, I actually personally haven't used tramadol for about 4 or 5 years now. I think there's always been this sort of thought of, does tramadol work, does it not work? And we're starting to move towards this trend of it probably isn't very effective in terms of controlling joint pain very well. Interestingly enough, in just one of the latest issues of the Journal of American Veterinary Medicine, Dr. Budsberg at the University of Georgia came out with a very, very nice study that utilized both positive, negative controls and placebos, and found that using objective data, there was no improvement in peak vertical force or vertical impulse in dogs on tramadol versus the placebo. I think rather than being a true opioid in controlling pain, probably what it does is it affects serotonin levels. And so it makes the patients kind of spacey, or owners will say that it really zonked them out, or they got really agitated or anxious. And in some situations we think maybe they feel better because they're kind of spaced out. Yeah, they're probably having a good trip, but they probably are still hurting a little bit. So I've moved away from using tramadol when it comes to joint pain. The problem is we really had no data to suggest that it worked, but then it was always pushed, use tramadol, use tramadol, use tramadol, and then it caught on like wildfire. So everybody started using tramadol when there was really no clinical evidence that it really was helpful.